Do not get your gallbladder removed.
This person says that you should never get your gallbladder out. She regrets it because she's having issues with what we call bile salt diarrhea. So let's go through some of the claims. Number one, if you have a bad gallbladder, there is nothing that is going to save it. When gallbladders go bad, they go bad. And you cannot fix them, you can't salvage them, and they need to be removed. If you don't remove them, you can have dangerous consequences. For example, stones in your gallbladder can go down, irritate your pancreas, you can get chronic pancreatitis and even die from that. Then if stones are left in the gallbladder for a long time and the gallbladder isn't removed, it's an increased risk of gallbladder cancer for which we have no good therapy. What this individual appears to be suffering from, and she should go back and see her surgeon, is something called bile salt diarrhea. When you remove your gallbladder, this is the gallbladder that sits underneath the liver, you still are making bile from your liver, but you make more bile after your gallbladder is removed. And for about 2% of people, they get what's called bile salt diarrhea. Ox bile doesn't fix that. It makes it worse. Digestive enzymes don't fix that. They really don't do much. But if you have fatty diarrhea from making too much bile, there is a drug called colostyamine, which with increasing doses can bind the bile and make it much more easy to tolerate fatty foods. And only about 2% of people have that. It sounds like she has that. And going on a low-fat diet and increasing fiber in your diet are also two things that you should try beforehand. But listen, people can get complications, but her gallbladder wasn't working, it sounds like, from her discussion. And if your gallbladder doesn't work, in spite of what different people will tell you, there's no gallbladder flush that'll work or liver flush that'll work. It won't get your gallstones out. Those are all supplements and scams that people are selling you. If you need your gallbladder out, you need it out. Nothing will save it. And you need surgery, otherwise sometimes you need emergency surgery. So please, if you need advice or help after having your gallbladder out, please go see your surgeon.